Now we are going to talk about weight regain after bariatric surgery, as I saw that you have been talking about weight regain, a couple of our patients in the support group. I thought maybe, talking all together would be more beneficial. Weight regaining after bariatric surgery. Yes, we do see weight regaining after gastric sleeve surgery or bypass surgery with some patients, especially in 1.5 years after the surgery. It may start. It's not with too many patients, but yes, it can happen. Does it mean the surgery was unsuccessful or you were unsuccessful? No, it doesn't mean that you're unsuccessful. First of all, you have been aware of that you need to change something and you had this surgery. You had a huge step to change something. This actually means you're successful. I think that's what I think. Just because you have regained some weight, it doesn't mean you're unsuccessful. It's very expected with some period of the life, gaining weight, losing weight. All of us actually experience it. The important thing is being aware of it, that you're here, you're trying to change something. That's what I think. Okay, let's start with the reasons of weight regaining after the surgery. The biggest reason, I think, is returning to old eating habits. Very expected because some of our patients is having this surgery when they're 30 years old or 40 years old, and changing 40 years old of habits is not that easy. It's possible, but not the easiest thing. So it's perfectly expected, but we can definitely solve this. Just need to be patient. Uh, Insufficient physical activity. We always say that physical activity, I can say that if the eating part is 60%, physical activity is around 40% with the weight loss and remaining the weight. Psychological and emotional factors, just as we talked, when the patients experience hard situations with their family or with work, they may start having emotional eating. It's also something we all experience. Most important thing is being aware of it. The most important thing is thinking like this. Yes, I'm now eating too much sugar. Okay, it's all we can experience, but I know that I'm having this because I'm having emotional factors. If you know that, then this is the first step of having a step and changing something. Changes in stomach capacity. Yes, this is a physical thing now. Sometimes in the early stages, for long term, of course, if the patients don't follow all the rules, especially the solid and liquid separation, or drinking fizzy drinks, or drinking too much liquids or foods at once, then yes, it's something can happen. You can stretch your stomach. It's not something happens in 1 day or in 2 days, but if you make it a habit to don't follow these rules, yes, we can stretch our stomach.
Benim slaytı göremiyoruz şu anda.
Göremiyor musunuz? Neden? Şimdi hala mı göremiyorsunuz?
Full ekran yaparsan iyi olur.
Beyza sesini çekmiyor. Heh. Gözüküyor.
Slide olarak gösteri olarak çıkmıyor ekranda. Sadece sayfa olarak görünüyor. Normal senin bu şekilde şey olarak. Böyle devam et olmadı.
Okay. Social and environmental influences. This is also a really huge factor, especially in these days. We want to maybe have some social situations. We want to be our friends, and when they're eating or drinking the foods that we shouldn't be have, yes, it's very expected that we want to accompany them. And surgical reasons, which I'm not going to talk about it now. I think Dr. Hüseyin may say something when we're finished then. Okay. What shouldn't I do? I want to start with what shouldn't I do, because these are actually very common coming from our patients. I'm gaining weight, or my weight is stopped, so can I do this? Can I follow this? Liquid diets, it is called pouch resets. Having too much protein supplements or products. Sometimes, yes, not having enough protein may cause weight stalls, or even, gaining weight. But sometimes, because you think that having too much protein is going to help you to lose weight, it can also cause you to gain weight. That's why we should always try to have whole foods instead of products. Too much calorie restriction, definitely unsustainable. You may follow it for 1 week, 2 weeks, even a month, but definitely not longer than that. Extremely strict, unsustainable diets is the same, and being impatient. Try to lose all the weight in a couple of weeks or even a couple of months. Weight loss is definitely something that takes a long time, changes to patient, something that you shouldn't compare yourself with anyone else, and focus on the progress, not just the result. So, liquids diet, about pouch reset, I want to say that it can be like a motivation, a start, if it's okay for you, but not sustainable, not as a result. And what should I do? Review eating habits. Yes. Is it easy? It's not easy. That's why we want our patients to keep a food diary. It's not something we just want. It definitely increases the awareness. It's not just for me to see. Yes, it helps me to see if is there anything wrong that you do, but also it increases the awareness of yourself. It doesn't take too much time. It's easy and really helps. Portion control, because with the especially gastric sleeve surgery, portions are really important. Listening your body, listening your stomach is very important. Increasing physical activity, I know it's not the easiest one as well, but what we recommend actually, start with the easiest ones. Maybe start with 10 minutes per day. Even don't start with 10 minutes. Even start with just wearing your sport clothes. Just wear them and sit at home. And then after a couple of days, start with 10 minutes of exercising. And then increase it to 20 minutes. And then increase it to 30 minutes. Find something you enjoy to do. Not just someone says this really helps with the weight loss, you should do this. No, find something you enjoy to do, whatever if it is. Monitor your progress is same with keeping the food diary. You should definitely do that. If you don't want to do that, just take the photos of your food, share it with your friends, or you can share it in the social media because it also helps with the motivation. Try mindful eating. Mindful eating is also not easy, I know that, but it's the most sustainable way. Don't watch TV when you're having your meal. Don't look at your phone. Focus on your food. Let your brain understand that you're eating that food. Smell your food, chew your food, take your time, and enjoy. Sleep and stress management is also has a huge role, just like the physical activity with the weight loss. If you're not sleeping well, if you're really stressed, this is also going to make you have too much slider food or too much sweet. Well, controlling the sleep and controlling the stress, you may need to get some help, maybe. Maybe you can, get over it on your own, but it actually really is important with the weight loss. Join the support groups and share your journey. Just do it. It's really important. The patients sharing their journey in the support groups with their friends or on the social media actually gets really motivating. And of course, set realistic goals. Just as we said, don't be impatient. Being impatient actually is going to bring you, unfortunately, the unsuccess. Okay. Foods that can cause weight regain after surgery. I think most of you know about them. I'm going to send this presentation to you so you can look at it all detailed. But it's basically the foods we call the slider food, high calorie, low nutrition food, just as sugary food or processed snacks. Chips, crackers, they actually are really addictive because you have this move and it's really addictive. High fat foods, fried foods, fatty cuts of meat is something you really need to be careful about. Refined carbohydrates, white bread and pasta or pastries and baked goods definitely something we don't recommend. I know they are delicious. Of course, you can have them, but it shouldn't be a routine. When you're just they taste the same. The whole grain pasta and white normal pasta taste the same, so you should try to make the right choice. And high calorie beverages. I think Dr. Hüseyin is also going to agree with this, but the liquids, beverages, sugar drinks, and alcohol is something has a huge role with weight regaining after the surgery because they don't stay in the stomach too long. They just go away. They don't make the pressure in your stomach. That's why, especially with the beverages, we really need to be careful about. Snacking between the meals. We always say that we should be careful and we shouldn't skip the snacks between the meals. But it should be balanced snack, high protein and high fiber snacks. Mindless snacking, having freaking snackings, especially high calorie items, is going to make you gain weight. Low protein products, of course, especially when you're having your snacks or even your meals. If you're not getting enough protein, it's going to stall your weight loss because the body is going to start protecting itself. That's why low protein foods may cause weight regain after the surgery as well. foods with hidden calories. Lots of patients actually don't really get aware about it, but especially with the salad, the sauces and dressings, the creamy or sugary dressings actually has too much calories in it. They may think like, I'm having my salad now and it's really healthy. Yes, it is, and you should have it, but you should be careful about the hidden calories with the dressings. The processed foods, ready-to-eat meals also is something like the hidden calories because they may have too much fat in them, and they're all raffinated, so we should be careful about them as well. So what we're going to do, we're going to make sure we're having enough calories. All our meals should have a protein source. It should be a lean protein source. Choose the whole foods. Yes, protein supplements always helps us with getting enough protein in, especially with the patients who may not eat enough protein, but the whole foods really helps with the fullness feeling. That's why, yes, you may have your protein supplement, but it's okay. Don't try to have your protein yogurt or protein bar. If you're having your meals, whole foods, you're going to have the fullness feeling more than that. Uh, Practice portion control. But how you can do it actually is eating slowly here is the key. Listening to your stomach, chewing very well is here the key. So you can feel your tube-shaped stomach. Stay hydrated, of course. Believe or not, but water intake is one of the most important things with the weight loss. Limit added sugars and fats. This is something all you know. Plan and prepare meals. This is also a key. When you plan your week, it doesn't have to be week. When you plan a couple of days, you can follow it. But if you don't plan your days, even if you don't plan your meals, you're just going to start eating whatever you find, especially if you haven't eat for a while, if you skip the snacks, if you skip the meals, just your blood sugar is going to go down, and whatever you find, especially if it's high in carbs and sugar, you're going to start eating it. Listen to your body. This is something all of us need to do. And of course, get in contact with your qualified aftercare team because you shouldn't be alone. You should know what to do. Okay, I have a sample daily eating plan here. Of course, it doesn't have to be exactly the same, but if you started gaining weight, if you started regaining weight, and if you're a bariatric patient, how can our day be? Here's a sample of breakfast. Maybe a bowl with Greek yogurt and berries with nuts. Bowls can be a great option for the breakfast, but scrambled eggs actually I always recommend my patients for the breakfast. Of course, it may not be the every day of the week, but at least 4 or 5 days of the week, the breakfast should start with the eggs because it's going to make you feel full. Lunch, grilled chicken salad because you're going to have the protein and you're going to have your fiber source. Or you can have the quinoa with veggie bowl. As you see, the goal is having a protein source and having a fiber source. For the dinner, baked salmon, of course, with some vegetables, and of course, with some high fiber carb source. Turkey and vegetable stir fry instead of baked salmon can also be used. It's the same. You always have a protein source and a fiber source here. Always say that don't skip the snacks, because if you skip the snacks, you're going to have 5-6 hours and not have anything, not eat anything. And after 5-6 hours of hunger, you're going to start having the carbs, because you're not going to do this, your body is going to do that. But if you have a balanced and have a protein snack, then your blood sugar is going to get balanced and you're not going to be starving and can have a balanced meal. So as snacks, you may have apple slices, maybe with peanut butter or some cottage cheese, or hard-boiled eggs even can be an option. Water intake, at least 2.5 liters, I'm going to say. You're going to see the difference. Start with the water intake. Start with increasing the water intake. If you're trying to change something, start with increasing the water intake. And exercise, as we said, it's like 40% of the weight loss. Just start taking some steps for it. It's very important. Motivation. What you can do for the motivation, you can share your journey on social media, you can keep a diary, you can find a friend having the same strugglings and share it with each other. Yeah, little notes. Rotate different proteins, vegetables, and whole grains to keep meals interesting and nutritious, because eating the same thing every day is going to make you get bored and you're going to stop it. So definitely don't eat everything every day. Pay attention to hunger and fullness cues to avoid overeating. Well, this is something all of our bariatric patients needs to do, listening their stomach, because if you eat slowly, you're going to give your body and your brain some time to give you the fullness signals. So this is very important. Thank you so much for listening to us. We're going to share this weekly meal ideas for you. This is just something you can use. It doesn't have to be exactly the same, because the portions are always different for everyone. You may not like the food written here. Just to give you some idea, maybe you can use it. It was all.
Okay, thank you, Melis. Of course, there is a lot of surgical reasons for the regain weight again. Based on
Hocam.
beni duyuyor musun?
Duyuyorum. Ha, şu an duyuyorum, evet.
Tamam, sen beni çeviriver. Tabii ki cerrahi nedenler de var geri kilo alımla ilgili.
Of course, you may also know that there are surgical reasons for regaining weight.
Baştan mide geniş bırakılmış olabilir.
So starting with the enlarged stomach left behind, because if there is if the stomach is not removed enough, then it may cause regaining weight.
Bazı cerrahlar mideyi çok daraltmaktan korkar. Çünkü ne kadar dar bir mide yaparsanız komplikasyon o kadar artar.
Because some of the surgeons can be scared of narrowing the stomach too much, because it can also cause some problems. That's why they may leave it in a normal size than it's expected from a sleeve surgery.
Bypasslar sonrası da poş genişleyebilir, anastomos hattı genişleyebilir.
And after bypass operation, the small pouch, the new pouch may also enlarge, expand, and also anastomosis can expand.
Bunların hepsi geri kilo alıma sebep olabilir.
These are all reasons for regaining weight, actually, the surgical reasons.
Bazen hasta her şeyi doğru yapsa bile geri kilo alım olabilir. Çünkü yaş ilerledikçe metabolizma yavaşlar.
Even if the patient do all the things right, as the time goes, this regaining weight can happen.
Ama önemli olan beden kitle indeksi 30'un üstüne çıkmadıktan sonra hastaya revizyon bir cerrahi gerekmez.
But the important thing is that you should know that the body mass index, BMI that we called, as long as it is under 30, there is no reason to do second operation, the revision operation. If it goes on over 30, then the second operation needs to be done.
Evet.